Hello everyone, this is Dr. Khan. So I have a nice pleasant 69-year-old lady who had a set of implants from 1973 removed 6 days ago. Very involved below the muscle, both ruptured. And now this is the first post-operative visit 6 days later. Let me ask you, what have you noticed in the last 6 days as far as how you're doing and overall your well-being after the surgery?
Immediately the first day, well, firstly, having propofol
Yeah.
for the anesthesia instead of what routinely is used for colonoscopies, which I had 2 weeks ago, so I know the difference. I had no word recall. It was very delayed for 4 days with the other. The propofol, I was talking for 4 hours all the way home.
Okay.
I didn't get lost for any words at all.
Sure, and this is very safe, very effective. What is Twilight deep sedation, where you're breathing on your own. It is not general anesthesia where you're paralyzed and the machine is breathing for you. This is the deep sedation, which is safe and comfortable. Now, one thing I want to highlight is you have rheumatoid arthritis for the last 25 years. Your implants, silicone, were below the muscle. You are also on Humira, which is an immunomodulator. You're also on the methotrexate. And relatively, given your age, 69, you're high risk, obviously, given the fact that you have ruptured implants with a lot of inflammation. What have you noticed post-op from your breast implant illness symptoms?
Well, I'm also on Plaquenil,
Yes.
being treated for sojourns, but I don't really have it, but my symptoms have it because of the eyes. My eyes were my biggest complaint these last 10 years. Going to neurologists, neuro-ophthalmologists, 2 ophthalmologists, trying to get cataract surgery because my 2 younger sibs already got it done. And they kept telling me I didn't need it, that they weren't that bad, they didn't see what to fix. It's okay. So I go home that day, sitting there watching TV at night, and my 2012 TV looked like a brand new, latest TV. Everything was sharp, the color was sharp. During a cloudy day, like this week while I'm staying home, on a cloudy day, I usually feel like my living room was a big fog, and I was in a cloud. I can see. I can see everything. I can read at night on my iPad. I could never do that. It keeps coming out while I'm in the lazy boy at night and I'm reading away. You should be doing that, you should be doing that. But I'm reading what all you people are talking about. And I can read, my eyes don't burn. If I forget to put the salve in my eyes at night, plus I use Excedra twice a day, and this is all because of the sojourns that I don't really have, but I have. If I forget to put the salve in, they're not burning in the morning. I used to wake up every morning with these really red eyes, and I go, is it the salve at night? Like, I didn't know what was making it. It's just I knew I could open my eyes in the morning if I put that salve in. And it's like, I just can't believe what I could read.
And amongst the many, many benefits that you have yet to see, where the surgery was just done perfectly, I would say in a sense that it had to be done right for you to bounce back because you were very involved. I remember the right side took almost 2.5 hours alone. And this is where 20 years from now, I cannot imagine anyone else doing the surgery any differently. And if I just may mention, it's the Sjogren's, which is the dryness of the eyes, which we all know from the many studies. This is what implants do. This is the big study out of MD Anderson, where they showed the Sjogren's was a big part of breast implants, where they looked at 100,000 patients. Also, if I may mention, this is the hydroxychloroquine, which is the strong medication that we know of around COVID time that was used, which is a very strong medication with a lot of side effects, including the Humira, which is an immunomodulator for rheumatoid, and also the methotrexate in itself is a strong medication. Now, what would you tell your rheumatologist who was totally or was against the idea of the surgery, where they said this was relatively invasive and not worth it? What would you tell your rheumatologist who now were to listen to you and your symptoms?
Her adjective was a horrendous surgery. She scared me away for about 4 months. And then I just kept reading more on the internet, and it's like, no, this has got to be. I'm frustrated with her. I'm frustrated with the neurologist. I'm frustrated with the ophthalmologist, all of them. They knew I had implants. It was on all my medical charts. Nobody said anything. I did not know about VII until December 2020.
And you did your research, and you basically, and this is what I see over and over again when we hear the women repeatedly, they take in charge, they're basically on top of the health that they want to provide themselves, overlooking what the plastic surgeons, primary care, rheumatologists, gastroenterologists, what you said, the ophthalmologist, neuro-ophthalmologist, everyone is saying, because deep down within we know this is real. Now, what would you say to someone that this is a placebo effect? This is the effect of the pain medications or the peri-operative medications that were given to you. This is all coincidental, that this is not going to withstand the test of time.
It's not. I was going to a neurologist because I thought I was getting MS. I had no balance. If I went outside with my dog and the light went out, I almost went to the ground to hold the steps because my feet wouldn't tell my eyeballs where to go. It's gone. I can walk around my whole apartment, and I do it at night with the lights off, just to make sure it's not like a fluke. It's real. I have a balance in the dark.
Right. Now, God bless you for sharing your story. You know, I want to emphasize, you know, I've seen this repeatedly so many times. I'm a million times convinced BII is real. Trust me, I would be implanting tomorrow, 6 in a heartbeat, if this was not the case. I saw this very early on. This is where we hear the women say repeatedly, BII, breast implant illness is real, where there's a real problem and a real solution. We'll continue to hear from you in the next 3 months, 6 months. You know, it is, again, the leadership that you are providing right now, not only for the U.S., but for the North America, South America, for the Middle East, for Europe, that we can say, you know what, BII is real, there is a real problem and a very real solution, so we can define with absolute certainty the right standard of care that everyone is entitled to. Now, God bless you. Thank you very much, and hopefully many people will find this informative.
Can I tell you, ladies, you are not too old to have this done. I almost talked myself out of it a number of times. But then I would have had very foggy eyes and no balance for 20, 25 more years. I almost lost that.
No,
Don't wait.
No, thank you very much. That was very strong what you mentioned at the end. And I hope other doctors, physicians listen to this and make a note of this. So hopefully we can provide the best care for our patients. Thank you again. God bless you.